Zoom meeting. So 6:31. Let's start off with the Cook Estate request to cease pumping. Bam.
So it doesn't look like Jane Reardon made it to the meeting tonight. Jane's the condo association president. But while we were at the last sewer commission meeting, she made a request to Jason and I to see if they could cease pumping because it costs them about $10,000 a month. They have been doing everything in good faith that we've asked of them. They've done an environmental investigation. They've hired an engineer. The engineer has been looking at alternative ways for them to connect to sewer. The sewer commission is just waiting for them to submit their application. They have to kind of figure out which alternative they're going to do. And it looks like they're going to go up Sawyer Street and down the driveway to the Dare Hill pumping station. So it's not like they've just been sitting around. They've been spending a lot of money in good faith to connect to the sewer system. And it's going to be a long, complex process. It's going to be super expensive for them because they're going to have to pay for construction and they're going to have to pay for connection fees. So Jason and I discussed it, you know, between the two of us, although the board has the final say, and we thought a good compromise would be to let them stop pumping every month, which would save them $10,000 a month, and just shorten the length that they have to connect to sewer. So currently it stands at 2 years, or we could reduce it to 1 year. And they really are trying to get connected within a year because they have other things going up against them, other limitations like the fact that they're going to go up Sawyer Street. Sawyer Street's going to get paved, and then there's a 5-year moratorium once that's paved. So they really, and the fact that every day it's like they're hemorrhaging money. So the faster they can get it done, the better off they'll be. So
do you have a sense for what the impact is of, I mean, obviously they're pumping half the half of the waste out, but is that going to lead to overflow like it was happening before? Or, I mean, so the monthly pumping, how did we arrive at monthly anyway?
Well, so there's been water leaking down their driveway. I have a feeling probably for years, and nobody really kind of noticed it, and except for Jason did. And we really noticed it not this past summer, but the summer before when it was extremely dry. We had a drought, and you could still see some water running down their driveway. And then he tested it, and there was the presence of some coliform and some nitrogen. Now, not like super high numbers, but high enough that you didn't want it going on forever like that.
Mm-hmm.
So, oh, here comes Jane now, actually.
And so the deal is that they won't have to pump at all, and then we go back to that situation, or is that the idea?
The idea is that we let it kind of go back to the way it was before. It doesn't, the water still continues to run down the driveway. It never really stopped it from doing that. I think it's mostly groundwater. So the septic was just kind of tainting the groundwater. It's almost like you can't stop it. The whole hill is filled with so much groundwater coming out the side that's not really going to change. So it's like, how much contribution do you want to allow for contamination to what's going down the driveway? I mean, it's enough that we know it's a failed system. We want them to connect, but it's probably not so much now that it's not going to make too big of an impact if it goes on for the next year or whatever it takes to get them connected.
Hopefully it won't be a year either. I mean, we're pushing the envelope as fast as we can. The other thing, about half of our residents go to Florida for all or part of the winter. So the flow diminishes pretty significantly starting really in January.
Got it. Okay. Robin or Lynn, any questions?
Nope.
Lynn?
No, I have in front of me the letter proposed letter from the board to Ms. Reardon. Are we about ready to accept that letter?
Lynn, do you have any questions?
I don't have any
Comments?
questions so far. I was just catching up, reading and listening to you guys, but no. we're good.
Okay. Yep, and then I think we're probably good to go. So can I get a motion to accept this?
I'll move that we accept the letter from the board to Ms. Reardon dated December 14th concerning the order for Cook Estate to connect to Cohasset Sewer System addendum.
I'll second it.
Okay, any further discussion? Okay, all in favor? Vote by
Aye.
yes. Aye.
Aye.
Aye, motion carries 3-0. Pam, I'll finalize the letter and drop it to you when the meeting's over.
Okay, and then
Thank-
Jane will send it out to you tomorrow.
Perfect. Thank you so much. I appreciate your
Thank
support.
Good luck.
Thanks, Jane.
Okay, thanks.
Okay, we need 3 more minutes to the next agenda item. So maybe we approve the meeting minutes from the 16th and the 19th. I had a chance to review them and they looked fine to me, but anyone see anything they want to have corrected or updated?
No, I'll move that we accept the meeting minutes from 11/16, 11/19.
I can second it, but didn't I miss one of those meetings?
Oh, that's true. Yeah,
Yeah.
you missed them. Yep. I second that motion. All in favor? Aye.
Aye.
Aye. Motion carries 2-0, 1 abstention. Okay, that's great. Let's set the next meeting date while we're here. What do we say? How do we feel about the 18th? Is that too far out?
We don't have anything else right now that we had to push off, so that would probably be okay.
Okay, so let's say 6th. Does that work with you, Robin and Lynn?
Yep.
Yeah, sounds fine.
Okay, so let's say 6:30 on the 18th. Whoops. Okay. All right, next item that we can probably cover in 2 minutes. So the public health nurse report is as submitted by email, and Mary's not here tonight to give the oral version of that. Pam, would you like to do your report? Start your report.
Sure. I would say just one of the biggest things is that we've learned from DPH that we can start scaling back contact tracing. Before Mary Goodwin and Mary Whitley were calling every single person that was a positive case. They were following them for 10 days. They would call them after 10 days to release them. They were calling their close contacts. Sometimes they were calling it in between when they first talked to them and when they released them for follow-ups. It was really, really, really detailed and intense. And so Mass DPH feels like at this point, they have so much data for, the epidemiology portion of it that it's really not necessary anymore to go into that great detail. So they want it to be more focused, and usually people can get just one phone call. And even then, there's so many cases because the virus is so transmissible now, first with Delta and now with Omicron, that people aren't severely ill, but there's tons of them. So now they're saying that people can just get one single phone call, and then even then you don't even have to call everybody. They want them to really focus on daycare programs, kids in K through 12 schools, any kind of clusters. So I think we're going to start to get some more help when we finally get a signed contract, which we don't yet for our grant, public health grant. We'll hire some more contact tracers, but I think we can really relieve our nurse team finally, because it's been grueling last year and whatever it's been, 8-9 months or something. So that's actually really good news. And then Omicron, from what we've heard from the state epidemiologists. So right now, nationally, like 80% of the cases were people that were vaccinated, including 14 people who were boosted. So there's a lot of breakthrough cases, but again, their symptoms are more like cough, fatigue, and congestion. And, they're not seeing the hospitalizations or deaths. So even though they're big breakthrough cases, they're doing the job and keeping people relatively healthy. But one other thing is, though, that while the cases have been mild by and large, the ages of the people that have been getting sick have been skewed low. I think it's a lot of people that are have been traveling. So are they mild cases because they're younger people, or is it that the Omicron is not causing as much severe illness? That's still kind of up in the air, but it is known at this point that it is very transmissible and probably greater than Delta. So for people like in Massachusetts, the nurses can see when people have tested for Omicron. At this point, it's not that many people in the state, but they can see it. And they're saying that you don't necessarily have to take any additional measures for people with Omicron. It's not like they require any more isolation or than anybody else. It's just, one more variant at this point. And right now there's city and towns, about a third of the city and towns in the state of Massachusetts that have been getting at-home test kits through the state for free. And it's been targeted at like low-income places. And so Cohasset has not received anything. But starting in January, if the town wants to, they can order test kits through this manufacturer where the state's getting it all at a discounted rate. So if we feel like, we want to start testing schools or something like that, we'll have an opportunity to buy them at a low rate starting in January. But we're not getting them for free like other places. And so that's about it. That's the additional information since my last report on Friday. Michael, you're on mute.
Thanks, Pam. Any questions for Pam before we move on to the next agenda item? Okay, thanks. All right, so moving on to 256 North Main Street, Caravanero Consulting.
Do you want
You're
to start
muted.
off? Do you want to start off and just approve the easement? Do you want me to show that on my screen, or if you guys had a minute to like peruse it? It's kind of standard, but you should really kind of vote on the easement just to approve it. Should I show it, or are you good?
This is the easement. Sorry, I need more information on that.
So the 256, 258 North Main Street is a shared system. So as such, they had to get two legal documents. They had to get a shared easement and they had to get a utility trust. And the utility trust doesn't really require a signature or anything by the Board of Health. The Title V easement does. The covenant and easement requires the signature, which typically is the health director, and that's who the lawyer wanted me to sign. But you still actually just need to officially approve it.
Mm-hmm. Okay. Any questions or comments, Robin or Lynn?
Nope.
Okay. So I will make the motion then to approve the utility trust document, the grant of Title V covenant and easement prepared for the shared septic system for 256 and 258 North Main Street.
I'll second it.
Any further discussion? Okay, all in favor, vote by saying aye.
Aye.
Aye. Motion carries 3-0. Okay, thank you for that.
Okay. Now I'll put the plan on my computer. I'll share it. Oops. Let's see. This is a big, complicated system.
Okay, so we have Cavanaro here to speak to this one.
Yes, hi. My name's Caroline Reese. I'm from Cavanaro Consulting in Norwell, Massachusetts. I'm here on behalf of Brendan Sullivan, who had a conflict tonight, to present the latest changes to this plan. I think this is a plan that's been presented a few times. Is everyone kind of familiar with it? The two changes are that the first lot sold, so it has a new ownership. It's now owned by Bow Street LLC, and the plan has been updated to reflect the new ownership on the right side, just so we have the owners of record listed. They're gonna rebuild, tear down, raise and rebuild a home there in generally the same spot. And the second item was that there was a request last time, I guess, to add the total number of bedrooms. The septic system's designed for 7 bedrooms, and the front lot is specified to have a max of 4 bedrooms, and the second lot, 256, will have 3 bedrooms. So that's how the bedrooms will be divided. I believe that's the only changes. All the homes will abide by the setback requirements for zoning and setbacks to the septic as presented. And I think that's all the changes. Is there anything needs to be explained?
Yeah, and so before adding the bedroom, Caroline, there was no garage over here, and that I think that tanks were over here, and then they kind of got moved back behind, and that's why I kind of thought that that board nearly needed
Gotcha.
to see the plan one more time. So I
Okay.
think there are about like 8 revisions in this thing.
Yeah, so I was looking through, trying to keep up. Yeah, I know they all abide by the required setback requirements. I don't think the pump system's changed from what you've seen. But
Yeah.
if that's a new change, I wasn't sure of it.
See, so thank you. So this looks like packing a lot into this lot. So it looks like we have a local upgrade request for the vertical separation from the soil absorption system above the high groundwater. We have a
Correct.
local upgrade request to reduce the required 4 feet of naturally occurring material. And yes, questions or comments from the board?
Nope.
Nope.
All right. 7 revisions is the magic number apparently. So
8.
8 revisions. Excellent. So we have 3 motions that need made. One for each upgrade, and then the motion to approve it. Anyone like to do that for us?
I don't have that on my screen, so maybe you can read it out.
Yeah, I don't either.
Then I will do all the motions. I'll make a motion to approve the local upgrade request 310 CMR 15405 to allow reduction of the vertical separation between the bottom of the soil absorption system above the estimated high groundwater from the required 4 feet to 2.5 feet with 10% reduction in SAS size.
A second.
Okay, all in favor?
Aye.
Hi.
Aye, motion carries 3-0. I make a motion to approve the local upgrade request 310 CMR 15405 to allow reduction of required 4 feet of naturally occurring material to 2.5 feet.
Second.
Okay, very good. All in favor?
Aye.
Lynn?
Aye. Sorry.
Oh, that's okay. I vote aye. Motion carries 3-0. And I make a motion to approve the shared septic system upgrade plan for 256 and 258 North Main Street dated 1/29/20, revised 12/3/21.
Second.
Okay, all in favor?
Aye.
Aye. Motion carries 3-0. Thank you, Ms. Reese.
Thank you very much. That was easy. Have a great night.
Yes. How are we doing? 6:50. Oh, right on time. Okay, next up, 330 North Main Street, septic system design with Morse Engineering.
Good evening. This is Greg Morse here for the applicant.
Hello. Pam's getting this up for us.
Excellent. So this is a septic system repair project at 330 North Main Street. My name is Greg Morse, registered engineer. I'm representing the property owner, Chris Collins Woolley. This is an existing 3-bedroom home located at the corner of Powers Lane and 330 North Main Street. The proposal here is to construct a new 3-bedroom septic system. It's largely in the same location on the lot. We would reuse the existing septic tank. The septic tank that's there is in good structural condition. The failed system was originally installed, I believe, in 2000, so it's really not that old of a system. But we would put it back in the same location for 3 bedrooms capacity. The system today is in failure, so this is a required upgrade. I turn it over to you.
Okay, and there's the Presby leaching system that's required for this. Can you speak to that?
Sure. So the septic system that's in place out there now, the one that was in 2000 was more of a traditional type septic system, a crushed stone leaching field. What we're proposing here is what's referred to as a Presby Enviro septic system. The Presby system is a series of corrugated plastic pipes. They're approximately 10 inches in diameter. You backfill it directly with sand. There's no crushed stone involved with this system. The benefit of the Presby system is that you can typically fit it in a smaller footprint area. You can take a size reduction credit of up to 40% by use of the Presby system, which we've done in this case. This case has constraints due to wetlands on the site, as well as significant ledge outcrops on the site as well, which is why you see the system in the location that it is.
Got it. Okay, Lynn, Robin, anything?
No.
Nope, I'm all set.
Straightforward.
All right. Moving
Want
right
me to-
along.
Do you
Yeah,
want me
go
to make
for
a
it.
motion?
Yes,
So
please.
I make a motion to approve the use of a Presby leaching system that allows a reduction in the separation to estimated high groundwater from the required 4 feet to 2 feet.
I'll second.
Great. All in favor?
Aye.
Aye.
Aye. Motion carries 3-0.
Thank you.
Get the other one. We need to now accept the septic design plan.
Sure.
Yep.
I can do it. I make a motion to approve the septic system design plan for 330 North Main Street dated 11/23/21 and revised 12/9/21.
I will
Second.
second that. Okay. All in favor?
Aye.
Aye. Motion carries 3-0. Thank you, Mr. Morse.
Thank you.
Great. Have a good night.
One more.
One more. Oh, yeah.
Oh,
Sorry.
he's got the
Back.
next septic
yeah.
as well.
Got it. Sorry.
Perfect. This property is located at 413 North Main Street. It's the corner lot of North Main Street, which is at the top of the page here, and then King Street, which is on the right-hand side. The lot's a little over 10,000 square feet in size. It has an existing 4-bedroom single-family home on it. It has a failed septic system. The proposal here is to put in a new Title V compliant system. The system consists of a Hoot aerobic treatment tank, a pump chamber, and then a pressure-dosed leaching field. The leaching field here is what's referred to as a GeoFlow, which is one of the drip leaching systems. This property here, this was back in front of the Board of Health, I believe, in 2014, and again at a later point, the board had approved plans at this site, this exact plan actually, but it was never built. So we've made no changes in the plan from what was previously submitted. But it requires 2 local upgrade approvals, one of them being a setback distance from the leaching field to the southern property line. We have a proposal of a 7-foot setback where 10 is typically the requirement. And then secondly, to allow the use of a sieve analysis instead of a perk test. The soils at this site were too wet to conduct the perk test, so a sieve analysis sample was taken. I'd turn it over to you.
Okay. Questions? We also have to vote on the leaching system as well, I think. Pam?
Yes.
Yes.
Okay.
So
Okay.
can I
Go ahead.
just tell you guys too, so if you decide to approve the system, it says like the system with the hoot, you should also include with a geoflow leaching system, because that's really what allows you to, have that reduction to separation to groundwater and the reduction in size of the SAS. So I missed that one with the geoflow leaching system, if you see what I mean, where it says
The
after
hoot
hoot.
leaching system with a geoflow.
Yeah. So a hoot system with a geoflow leaching system. Sorry about that.
Okay. Questions, comments?
Um,
Robin, do you
Hmm.
remember reviewing this in 2014? I'm just kidding.
1914?
Very good. How about, so we have 3 motions. Lynn, do you want to rattle them off?
Yeah, I can.
Or
I
4,
can-
actually.
4, right? I can
Mhm.
try. Let's see. I make a motion to approve the use of a hoot leaching system with a geoflow leaching system that allows a reduction in separation to estimated high groundwater from the required 4 feet to 2 feet and a reduction in field size from 100% to 60%.
I'll second.
Okay, all in favor?
Aye.
Aye, motion carries 3-0.
All right. I make a motion to approve the local upgrade request from 310 CMR 15.405 to allow the setback from the soil absorption system to the property line from 10 feet to 7 feet.
Second.
Great, all in favor?
Aye.
Aye.
Aye, motion carries 3-0.
Okay, I make a motion to approve the local upgrade request per 310 CMR 15.405 to allow the use of a sieve analysis for the determination of an effluent loading rate in lieu of a percolation test.
Second.
Okay, all in favor?
Aye.
Aye.
Aye, motion carries 3-0.
And lastly, I make a motion to approve the septic system design plan for 413 North Main Street dated 11/30/21, previously revised 7/15/2014.
Second.
All in favor?
Aye.
Aye, motion carries 3-0. Very good.
Thank you very much.
Now we wish you good night, sir. Thank you very much.
You too. Thank you.
Bye.
Bye.
So we powered through the rest of the agenda, but one of the things that I'd like to just talk about briefly. This is something that was we also have to talk about the mandate, right? So presently both counties are high, and we are well over the 15 cases in town over the 2-week period. So the mandate remains in order, in place rather. And I also just wanted to mention to the board, and you've probably seen the email traffic about the schools have approval from DESE to remove the masking mandate in the high school that was effective last Monday. And then the middle schools, which will be over the they will be over the vaccination percentage required by DESE. They're going to kick that off in January. And I just wanted to share with the board that I exchanged some emails with the superintendent and with the chair of the school board to basically start a conversation about what metrics they're using in order to keep track of that. So I'm only aware of us and one other school system in the state of Massachusetts. I think this is a true statement, that have now optional masks in any of the school system, in any of the school buildings. So it seems to me, especially given the Omicron surge and the just general holiday season and such and like, that it would make sense to have a close look on, cases that are spread and so I intend to have a call, and Pam will be in on it, as well as Mary, to talk about, so how are we keeping track of it? What are the triggers to roll back that mandate, to roll back that option, et cetera. So I just wanted to raise that. Pam, do you want to add anything? Sorry, go ahead, Lynn.
Oh, so I just have a question. So when you said us and one other school district are the only ones that are masks are optional, is that because we're the only two school districts that's reached the 80%? Or have districts reached 80% and decided to still keep the mask mandate in place?
I don't know I don't know the answer to that. I do know that, and I'm looking at Pam because I want to make sure it's just two, just to be completely accurate, but
Yeah, I think it's just us and Hopkinton, I think.
so the school district has to actually write to DESI and request it on the basis
Yeah.
of the data. And so it's either other towns are not at that level or other school districts are not doing it.
Okay.
Yeah, I mean, we
just
could
a
probably look
comment,
at the vaccination data and see if there's other towns. I don't know.
just a comment, this should be responsibility of the schools, not ours. We collaborate with them.
Right. No, I agree.
So,
And in fact, that's in our masking mandate the public health order.
I mean, the school should be keeping, quote, a finger on it and reporting to us routinely. And then together we work together rather than, it's not our program. Just, okay, you agree?
Yeah, no, I agree. I think what I'm getting at is, I would like to, and I know the school nurses are talking to Mary also and keeping in touch and tracking cases and such. I guess what I want to do is, as the Board of Public Health, it seems like we would want to make sure the school department is thinking hard about any kinds of decisions that might need to be made if they got an outbreak, for example. What constitutes an outbreak? What would constitute them having to pause the mask option?
Right.
But it's, we're not going to tell them what to do at this point, because we basically said that they have the sort of the wherewithal to make the decision based on their own practice and policies in conjunction with the state.
Okay, good. Sounds good to me.
So I don't feel great about that. I don't feel great about this, by the way. It makes me nervous, but it's also, if we're going to start moving towards the reality of this being sort of an endemic disease and it's being manageable by high vaccination in terms of reduced morbidity and mortality because of the vaccination. Well, this is going to be the example that we'll point to. We'll say, yep, we did this after we had, the vaccination in the schools is like 90%. It's really impressive, actually.
It is really impressive.
So, if it doesn't work in the schools with 90% vaccination, then something's not quite.
We're in big trouble.
We're in big trouble. But I'm still a little uneasy with it. But we have to just let it run its course and see.
And Michael, I'm sorry I didn't copy you when I was in that email chain this week. I saw dear Board of Health members or something. So I just assumed you guys were on there. I didn't really look too carefully to see.
It was addressed to the school board and you. So we got a letter from a parent expressing concerns about masking, ongoing conversation about that. And the school board tackled it pretty. We can circulate the traffic so you can see. But yes, tensions are high still.
It's the same people though that we heard earlier, back in August.
Mhm.
That hasn't changed. But it's we kind of knew it was going to come up that when masks came off, but only for vaccinated people, there were going to be people that are going to be really upset about that.
Right. The argument being it's a social shunning of people who aren't being vaccinated for one reason or another.
Right.
And it's going to have an impact on their mental health and well-being and social status and all this stuff. And I mean, it's not unreasonable, but we can't be driving public health decisions based on that, unfortunately.
Right. And right now, all the controls with the state of Massachusetts, DESI anyway.
I guess
So-
I would argue though that I'm sure there are many people who are vaccinated that will still wear a mask.
Oh, yes.
Right. So, I mean, that social shunning, I don't think has come yet because I do think that there are quite a few people, and it's those that are vaccinated that are actually believing in masks as an extra precaution. So.
Yep.
Just my 2 cents.
Yep.
Okay.
Yeah, so this is going to be interesting as our cases really start to escalate. What's going to happen? Last year, January was when we really hit the peak. So next time we meet, January 18th, it'll be interesting to see where we are.
Well, this week
Okay.
was also the first week. Like, so now is the time where cases would spike after the mask came off on last Monday in the high school. So, and I haven't heard anything, to be honest. So,
But if you think about everyone traveling for the holidays, right?
yeah, I know.
That's
Yeah, the timing of
wasn't
this whole
expected.
thing was a little unfortunate
Yeah.
between the holidays and the winter season, but
I was expecting quite a bit more outcry actually about that. I didn't hear a thing, you know. So,
yeah.
so be it. But then again, I'm not on Facebook, so I don't know. Okay, so I think we're done.
All right.
Unless anyone has anything else.
I make a motion that we adjourn.
I'll second it.
All in favor?
Aye.
Aye.
Aye. Motion to adjourn carries 3-0. Thanks very
Thank
much,
you.
everyone.
You guys.
Have
Happy
a nice
holidays.
holiday, everybody.
Yes,
Happy
you
holiday,
too.
everybody.